oftentimes when we look at the shoulder, we think only about the muscles on the back of the shoulder. In fact, there are lots of muscles that act on the shoulder, including the pectoralis muscle, the serratus muscle. You see the serratus, it's not one of the sits muscles, but it definitely acts on the shoulder. Sits muscles are the supraspinatus, infraspinatus, teres minor, and subscapularis. So say those with me, with your mute on, please. Supraspinatus, infraspinatus, teres minor, and subscapularis. Supraspinatus, infraspinatus, teres minor, and subscapularis. So if we look at the muscles of the posterior, it should be pretty obvious how those muscles function. If you can, we have to get oriented first to make sense of all this. It's kind of a mess when you first look at it, right? So here you have the spine of the scapula, and then this is the humerus. It's called the greater tubercle of the humerus. So a tubercle is a bump, right? And if we strip the muscles away, you can see like the tubercle much more clearly. Here's the humerus bone right here. Here's the bump. And then here is the spine of the scapula. Oh, my poor dog is so scared. Something scaring him. Okay, so we have the infraspinatus muscle, and then we have the teres minor muscle, infraspinatus, and then teres minor muscle. Teres major is down here. It's not considered one of the shoulder girdle muscles, but you can see clearly it attaches to the humerus. And we think of these muscles back here as being the shoulder girdle or sits muscles proper. And then the supraspinatus is up here. I'm sure I can find a larger picture for you guys. But before we look at the larger picture, I want to show you guys the muscles on the front. Yeah, so this is, I'm sorry, that's a little too abstract. So I'm looking for the subscapularis. Let me just pull one up here. So if you look at the body from the front, so here's the front, right? So the rib cage and sternum. Here's the clavicle. This is the spine of the scapula, under the clavicle, behind the clavicle. On the front surface is the subscapularis, and you can tell that it attaches to the more inside, more medial aspect of the humerus. So which way, Emmy, which way is the subscapularis going to rotate the humerus? Is it going to rotate it internally or externally?
It would be internally, right?
That's correct. And the majority of the muscles on the posterior aspect of the shoulder, they attach to the external portion of the humerus. So they would rotate the humerus which way? Externally or internally?
Externally.
Externally, that's right. That's right. Okay, you can mute yourself. Thank you very much. So there's a feature on the bone that I want to tell you guys about. And it's a little bit into the nitty gritty, right? And I don't know if they're going to ask you this or not, but if they say, you know, what muscles attach to the greater tubercle of the humerus, or what muscle is between the greater and the lesser tubercle of the humerus, and you don't know it, maybe you even freak out, like you panic a little bit, you definitely will miss the question, and you don't need to. You don't need to miss the question. So let's take a look at those features. So this is the shoulder with the scapula and the humerus. Everybody unmute yourself. Are we looking at this from the front or the back?
The back.
One more time.
The back.
It's from the front.
Right.
Is that you, Rosie, who said the back?
Yeah, it's at the back.
Okay.
I also thought it was the back.
Okay. So it's a little difficult to tell in like a two-dimensional drawing, but if you look at this bone here, this bone should hopefully look like it's in the front. right? That's the clavicle. And then if you look at this socket, oh, also this bone here looks like it's pointing to the front. Again, it's two-dimensional, it's a little hard, right? This looks more like a concave surface than a convex surface. So here's the front of the scapula, the anterior face of the scapula. And this joint here, the glenoid joint, should look like it's facing a little bit to the front. It kind of faces laterally and then about 30 degrees to the front.
Could you just briefly go over concave and convex?
Yes, absolutely. So if you look at the scapula, concave means cave shaped, right? Like a cave, you go into something that's hollow, and convex is the opposite of a cave. So here's the front of the scapula. I can tell because here's the coracoid process that's pointing toward the front. And here's the spine of the scapula, which is on the back, right? If you look at the front of the scapula, can you see how there's a ridge, like a raised ridge? Ridges are raised and valleys are, what's the opposite of raised? Valleys are sunken, hollow. Can you see there's a ridge there?
Yeah.
And then inside the ridge, there is a depression or like a very shallow valley or a cave, concave. And if you look at the back of the shoulder blade, there's also a ridge, but the surface overall is not strictly concave. I mean, nothing in the body is strictly anything. That it all travels in, like, there's no right angles, there's no straight lines. You know, it's all bendy and twisty and confusing. But the surface here is less concave, I would say, and more convex, because you have this big thing there pushing up, this big ridge here in the middle. You have sort of like two ridges, three if you count the spine, whatever. If you look at the front, it looks more convex than concave. It looks more concave than convex. They're not going to ask you which one is more concave, which one is more convex. That's not a question that they're going to ask, right? But just to get oriented, you look for the bones. Which one looks like it's pointing forward? This one's pointing forward. This one's pointing forward. This one's not. So this looks like the coracoid. I'm sorry, am I cutting someone off? Just speak out if you have something to add. And then this one is pointing forward-ish, right? We know this is the spine, so this must be the back of the scapular body. This is the front of the scapular body. You're not going to need to know the lateral angle, all these details, superior angle, superior border. You're not going to need to know all those. You'll need to know medial and lateral, superior, inferior. You need to know those. You'll need to know the coracoid process and the acromion and the scapular spine. The reason you have to know those really is because the acromion, because of the joints that they form and the muscles they attach to. You guys want me to take you through those now?
Okay. Yeah.
Can I hear more than one person? Yes? No? So the acromion, you can remember acromion because of the acromioclavicular joint. So the acromion attaches to the clavicle, and here it is. So here's the acromion, and here's the clavicle. Is this what feature is this right here?
The spine.
That's yes, very good, very good. You know, can I confide something in you? I just learned that. I just figured out supraspinatus, infraspinatus, like 2023. You know, raise your hand if you got your degree in 2020 in 2005. So anyhow, spine of the scapula. So this must be the posterior aspect. This is the medial portion. This is the lateral portion, inferior and superior. Okay, so clavicle, acromion, acromioclavicular joint, AC joint, acromioclavicular joint. On the on the coracoid process, from the coracoid process, you can, there's a muscle that attaches, it's called the coracobrachialis. Coracobrachialis. You may remember that, or you may not, but it's a muscle that is kind of a synergist for the biceps, right? You can see that its origin is a thin, it has a small origin site. So it's not going to be a strong muscle, right? It's smaller bicep. It's one belly. The biceps is two bellies, but it attaches to the humerus. It's sort of a synergist for shoulder flexion. What plane is shoulder flexion in? Sagittal or frontal?
Frontal.
Frontal is coronal.
Frontal.
Frontal is coronal. If you abduct, you reach the corona. So is it frontal or sagittal?
Sagittal.
Sagittal. Yes, very good. Sagittal. So the coracoid process, the coracobrachialis, right? And then the glenoid cavity or glenoid fossa. Fossa is the same as cavity. The glenoid cavity or glenoid fossa can be remembered by the glenohumeral joint. So the glenohumeral joint, or the humeroglenoid joint, glenohumeral joint. Okay. How's everybody doing? Is everybody completely fried?
No.
You getting there? Can you
Get there.
can you hang for a little bit longer?
Yes.
Yes.
Okay, great. We'll take a break soon. I have no desire to wear you guys out. So if we're looking at the shoulder, now we're oriented, right? Here's the front of the scapula, anterior portion of the scapula, lateral border, medial border, inferior, superior, clavicle, acromion. What's the name of this joint? Acromion and clavicle. What's the name of that joint?
The clavicle?
Yeah, okay. No.
Acromion and clavicle.
And clavicle.
Acromioclavicular
Right.
joint. Perhaps I should write that down for you. I'm sorry, say again?
Yeah, that's it.
Yeah. Perhaps I should write that down for you. I'm just going to stick it down here. This is not organized, but I should stick it down here. AC joint, acromioclavicular, coracoid process, coracobrachialis muscle. Yeah, so you see the front of the shoulder, here's the humerus, and there are bumps on this thing, right? There's tubercles. So here's a smaller bump and a bigger bump, a smaller tubercle and a bigger tubercle. Lesser tubercle has a subscap muscle attaching to it, subscapularis. So the fibers go like this. This is the anterior portion, and it's slightly what? Internal or external? I'm sorry.
Internal?
It's slightly more medial or lateral, I should be saying. It's slightly more medial.
Medium.
Medium.
Yes. And here, so the subscapularis attaches to the lesser tubercle, which is the medial aspect, and rotates the arm bone internally. The greater tubercle, the bigger bump, the greater tubercle, let's see if they have it. No, the greater tubercle has all the other sits muscles, the other three. So it has supraspinatus in the front. I'll find you. And then they have infraspinatus in the middle. And then they have, and then it's the, let me find this side view. Yeah. So now we have to get reoriented again. Okay, so we were looking at it from this angle. All right, we were standing right here, looking at the shoulder this way. The shoulder blade is back here. This is the back of the body. This is the front of the body. We were standing in the front. Now we're looking at it from the side. We're looking at the shoulder from the side. Imagine part of the shoulder blade back here, right? So what we're seeing is the side and part of the, and kind of like the front. And here's the lesser tubercle, here's the greater tubercle. Does everyone know where we are now? Does anyone not know where we are? Please speak up if you don't, if you're not oriented, if you don't know where we are. Because I will show you.
Okay,
You good?
yes,
Okay, excellent. So this is the front, here's the subscapularis. This is the lesser tubercle. Here's the back, this is the greater tubercle. And you can see, and here's more posterior, right? So this is from the side and the front, this is from the side, a little bit more back. So from, say again? Okay, from the front to the back, the attachments are supraspinatus, infraspinatus, teres minor. Supraspinatus, infraspinatus, teres minor. And they all attach to the kind of the more lateral aspect. The subscapularis is the more medial. The supraspinatus, infraspinatus, and teres are more lateral attachments. So it should
So
make sense.
B is the back, is posterior.
This view is seeing the posterior.
Yeah.
And the back is the posterior, yes. Did I answer, was that your question? Is the back the posterior?
Yeah, I was
Yes.
just wondering if it was posterior. Okay.
okay.
Yes, the back is always the posterior. So the sits muscles, the three of them attach to the back, greater tubercle, to the back, the greater tubercle. And one of them attaches to the lesser tubercle, which is more in the front,
Okay.
more in the medial. In between the two of them, in between, there's a tendon, the biceps tendon. There's a bicipital groove. So in between them is the biceps. So if they ask you about these structures, the lesser and the greater tubercle, immediately, I want you to draw up the three sits muscles on the greater tubercle, more on the back of the shoulder, and one muscle more on the front of the shoulder and the biceps between them. And if you can just remember that, three on the back, one in the front, and the bigger tubercle, the greater tubercle is in the back, then you can navigate most of the rest of it. But if you can commit them to memory, I think a great way to actually, just need to see myself to do this. I think a great way to actually commit them to memory is to feel them on the shoulder. So you just find the groove in the kind of front side aspect where the biceps tendon attaches. It's not difficult to find. You can go like this. You can flex your biceps, and you'll feel the tendon moving a little bit. You have to actually lift your arm a little as you flex. My kid didn't make his bed. I'm glad you guys are seeing all that. All right, lift the arm a little bit, and you'll feel the biceps tendon moving a little bit. Okay, so now you have the biceps tendon. You have the bicipital groove, so you know where kind of the front, a little bit inside, is located. Just inside of that is the subscapularis. So if you move your finger just a little bit inside and then you rotate internally, you should feel some muscle fibers starting to contract. It's better if you keep your arm down. Right, here's the biceps tendon. And now if you put three fingers away from on the outside, here's the biceps tendon, biceps groove. And you should feel right on the side, there's like a bony protrusion. Any of you guys ever like fallen on your shoulder or like got punched there? Got hit there?
Yes.
That's like right where you get hit, right? There's tendons there, right? There's tendons there. So you just put your fingers like that. Just go approximately, 3 fingers for 3 tendons. You remember it's the other 3 of the sits muscles, right? And then you can rotate your arm externally. Do you feel those fibers starting to contract? If you don't feel them contract, put your arm against some kind of resistance. So a wall, I'm using my knee, and then press against that resistance. and they'll pop out into your finger. So I think that's like a really important way to do it. You know, also, you're going to be locating these things for other people. Clinically, keep in mind when somebody comes in and they've had shoulder pain for more than like, if it's acute and it's really bad, or if they've had it for more than a few weeks, the whole thing's going to be inflamed. You can't palpate the tendons and discern, okay, the problem is the supraspinatus, not the infraspinatus. Stuff's too close together in there. Talking about an area that big. But I hope that they don't ask you all those, but if they do, I'll be so proud if you guys nail that. Okay, what other muscles do I want to take you guys through? Let's do the muscles of the spine after a break. I think you guys need a break. Okay, so if you watch this video, right now it's called MBLEx Kinesio 12 review, study this first. But I'll give you a link, so and I will change the name. But if you look at this video, it walks you through everything that I walked you through today, the anatomy of the shoulder. There are some questions from a test prep. There's muscles of the neck. We'll be going over the anterior and posterior triangles of the neck. That's a question that I've seen on the review sites. This is Hugo Prep. This questions on here from Hugo Prep. They're good questions. And then we also go through the pec minor. I talk very specifically and in depth about the pec minor and the pec major, probably more than you need. But if we start with more and then, you know, leave some things behind, that'll be more efficient than not including them or adding things in later. The serratus anterior, and then we get into all the things that we just discussed about, different fiber directions. I talk about the muscles of the back, which we're going to do next time, and then all the stuff that we covered today about getting oriented on the shoulder and finding the greater and lesser tubercles, the muscles that attach to the posterior, the anterior, where's the biceps brachii, how to feel that on yourself, etc. Right, and I give you a few different views from a few different sources. One of them is from above the shoulder. Anyway, this is a good video, and I will give you the link for that. And please watch this video.